NEET PG preparation, tips for improving your score in clinical questions. There's no denying the fact that the percentage of clinical and applied questions, including picture and video-based questions, have increased in the recent NEET PG exam. The latest exam pattern focuses on questions in the form of paragraphs that evaluate the applied knowledge instead of straightforward one-liners. It is abundantly evident that the examiners are now focusing more on testing aspirants' clinical skills than just their knowledge of theoretical medicine. So, how do you tackle them? Watch this further and get useful tips too on how to improve your NEET PG score by accurately answering all the clinical questions. Know what to expect. It is important for every NEET PG aspirant to understand the syllabus and the areas from where clinical questions are usually asked. The clinical subjects in NEET PG include anatomy, physiology, biochemistry, pharmacology, pathology, microbiology, forensic medicine, and social and preventive medicine. Make sure you have a clear understanding of all the topics covered in these subjects and the weightage they carry in the final exam. Knowing all the high-yield topics that are included in the syllabus will give you a clear idea of what to focus on and help you plan your study schedule accordingly. Develop strong conceptual understanding. In the NEET PG exam, the majority of questions will be application or diagnosis-based. They will incorporate your MBBS courses preclinical, clinical, and paraclinical lessons. To answer these questions accurately, having strong basics and clarity of fundamental concepts of all subjects is a must. Having a strong conceptual understanding of the basics will enable you to apply your knowledge gained and answer more questions accurately. PrepLadder understands this very well, and therefore, to align your NEET PG preparation as per the next exam pattern, we have now added 70% clinically oriented questions in our QBank next edition. Moreover, you will also get explanations for all the correct and incorrect answers with relevant video and treasure tags for easy recalling of concepts. The QBank will provide you the concepts to train your mind and also offer insights into the usual traps. Understand clinical correlation. Clinical subjects in NEET PG are clinical in nature, and it is important to understand the clinical correlation of the subjects. This means understanding how the subjects are applied in real-life clinical scenarios. You can do this by reading case studies, attending clinical rounds, and reading relevant clinical journals. Understanding the clinical correlation of the subjects will help you apply your knowledge in real-life scenarios and improve your score in the NEET PG exam. Practice with MCQs. The NEET PG exam is based on MCQs, and it is important that you develop your test-taking muscle by practicing as many MCQs as possible. This will help you get a feel of the exam pattern and understand the type of questions that are asked. Most importantly, it is important to put your clinical learning to test by diligent practice clinical-based questions. PrepLadder's QBank is equipped with 70% clinical-based questions as per the latest exam pattern. It will give you access to a plethora of clinical scenario-based questions, which you can use to practice and build your analytical skills. Use the strategies while practicing MCQs to further strengthen your preparation. Actively engage in solving MCQs. Read each question and the subsequent options mindfully. Practice a structured approach to answering questions. Practice deductive reasoning. Give yourself less than a minute per question. Remember to go back and learn from your mistakes. In addition to that, make sure you are monitoring your progress, identifying your weak areas and making improvements. Practice speed reading and comprehension skills. Speed reading and comprehension skills are important for MCQ-based exams like NEET PG. You have only 3.5 hours to answer 200 MCQs. Having the ability to read and comprehend quickly can help you complete the exam in time. Plus, quickly comprehending the content of a question can help increase the accuracy of your answer, as you are less likely to miss important details or misinterpret the question. Here are some tips to help you build speed reading and comprehension skills for the NEET PG exam. Instead of passively reading through text, actively engage with the material by underlining keywords, taking notes, and summarizing information in your own words. This will help you retain information and better understand it. To increase your reading speed, try using techniques such as skimming, scanning, and chunking, which involve quickly reading through text to identify important information. To improve comprehension, practice reading and understanding complex texts and passages, and try to make connections between new information and what you already know. Memory techniques such as visualization, repetition, and association can help you remember information more effectively. Regular practice is key to improving your speed reading and comprehension skills. Set aside time each day to practice and track your progress. By incorporating these tips into your study routine, you can develop your speed reading and comprehension skills and become better prepared for the NEET PG exam. Focus on high-yield topics. It is essential to focus on high-yield topics while preparing for the NEET PG exam. These are the topics that carry a higher weightage in the exam and are more likely to be asked. Make sure you have a thorough understanding of these topics, as they can help you score well in the exam. We have listed high-yield topics from various subjects in our video. High-yield topics for pharmacology, high-yield topics for radiology, high-yield topics for pediatrics, high-yield topics for surgery, high-yield topics for ophthalmology, high-yield topics for forensic medicine and toxicology, high-yield topics for PSM. Revise regularly. Regular revision is an important aspect of NEET PG preparation. It is essential to revise the topics you have studied, as it helps to reinforce your learning and improve your retention. You can use flashcards, mind maps, and other revision techniques to make your revision more effective. Regular revision will also help you identify any gaps in your understanding, so you can focus on improving those areas. Everything you need to know about next. Lastly, you must remember that clinical questions are usually not hard. Yes, they will test you on your knowledge of fundamental concepts and cross-cut several medical disciplines. But the fact is, if you alter your skills as per the new exam pattern, develop better conceptual understanding of the subjects, including speed reading and comprehension, you can gain an edge over your peers. For admission guidance, you can visit www.medicaleducare.com. Thanks for watching.